Good evening. I'm going to be going over what you should be studying for the midterm exam in the course. Just grabbing the book. Chapter 1. You should be looking through Chapter 1 to understand what are important components for improving the health of all Americans. Now, as far as this goes, the health of Americans really has a lot of different components to it. So I just want you to look that over in the chapter and understand it. And then we talked in Chapter 1 about why there were many more chronic diseases that are being treated in our healthcare system. We also talked a little bit about infectious diseases in this chapter, and the idea that there is greater access to healthcare. So all these are important in Chapter 1. And we also said that one of the aspects of healthcare is that people do desire excellent technical performance, and that's important for individuals because of technology, and we're all aware of technology as well in terms of healthcare. And we also, I want you to, moving on to Chapter 2, look at concepts in Chapter 2 deal with the overview of the healthcare system and basically different types of categories of healthcare and services that are part of the healthcare system. In this chapter as well, we talked about some of the legal issues which have to do with consumers' rights and informed consent. Okay, in Chapter 3, paying for healthcare services, we talked about healthcare financing and how is healthcare financed. So important to know how healthcare is financed and the different kinds of payers, mainly private and public payers as well. And then, of course, significant to the change in healthcare reimbursement was the fact that we had Medicare and Medicaid based on the Social Security Act of 1965. So that's also part of that chapter. Okay. And then we basically, Chapter 4 talked about aging and the aging population and some different facilities in terms of the aging population. So just review that. And then in Chapter 5, we talked about the timeline of healthcare reform. And that's a short chapter. Chapter 6, medical information and technology. And there's different kinds of medical information and technology. A lot of the work performed by biomedical engineering, people who use their knowledge of biology, medicine, technology, and mechanical engineering, they develop the new equipment that we so need to use. Also in this chapter was the idea of using the electronic health record, and that's important for us to know about the electronic health record. Okay, Now, the next part, chapter 7, started with healthcare planning and careers. And in terms of planning and careers, we know that the shortage in doctors is projected very significantly, and we also looked to the fact that hospitals are still employing a very large number of healthcare workers, and that we healthcare workers often fall into two categories: those that are on the more professional level, and those that have kind of a more technical orientation to their situation. Now, I also gave you a couple of questions in terms of educational requirements for different healthcare careers. If you look at some of the case studies, the questions, so I want you to review those as well. The questions that I handed out, okay? And then we're looking at the next chapter, chapter 8, in terms of developing a career. And in chapter 8, developing a career, we just kind of want you to know some core issues in terms of professionalism and ethics, and the idea of licensing, and there's some legal terms like negligence in that chapter. Now, chapter 9, the different types of healthcare practitioners, we started chapter 9 about physicians and surgeons. So in terms of that, we know that we are going to need a lot of medical people because the Affordable Care Act has given people more access. We also have a good number of aging individuals. So different kinds of doctors that you should review: the doctor of osteopath and the MD. Those are the different kinds of doctors. And doctors work in a lot of different fields of care. Sometimes they work with the elderly, sometimes pain management, sometimes hospitalists, and also sometimes palliative care. That's a relatively new field for physicians, and it really does help to treat people with a serious chronic illness. Doctors need to have a minimum before they go to medical school of usually 3 years or 4 years of college, and that's because there are some combined programs where you can actually go and get a medical degree in 7 years. Okay, so that is probably the minimum that they need. We did talk about the Doctor of Podiatry with the initials after their name, DPM, Doctor of Podiatry. And doctors who are podiatrists, podiatric medicine, they have a 4-year degree after they complete their 4 years before of college. And of course, all of the different professions all need a license. Some people get certified first and then get a license. Doctors usually get a license first and then they get certified in an area of specialization. Okay, again, podiatrists have a lot of training. They have a long road that they take, and they have to take a test before they get in. To podiatric schools, it's usually the same test as a doctor takes. Podiatrists have to be licensed, and that's important. And then we talked a little bit about finances and how these various professions do, physicians, surgeons, podiatrists, and they all do fairly well. So their compensation is pretty high. Then we talked about physician's assistants, and physician's assistants must go to a school. So the physician's assistant chapter, now we are on chapter 10, and a physician's assistant has to go to an accredited program, and they have to pass a test before they can get a license. And there's a great amount of growth for physician's assistant, as your book tells you, and it's a very good field. They have to take the PANCET exam, and it's required now throughout the country for them to take this exam. Okay. And physician's assistants, as you remember from the interview, they have a lot of different skills that help them to serve patients. So important to review in Chapter 10 all of the different skills physician's assistants have. They take a lot of theory and classes, and that's important. Okay, and that's pretty much it for physician's assistants. And then Chapter 11, we talked about nursing, very high demand for nursing because of aging population, because of how many people have access to health care. So there's a very high demand. And we want to make sure that people have the quality that they need. The people, as they get older, are going to need a lot of care. They're not as healthy most people, when they get older, are not as healthy as when they're young. So registered nurses can get their license within as little as 2 years, And registered nurses have a lot of different responsibilities and can work in a lot of different places. And then you have the licensed practical nurse. The responsibilities of a licensed practical nurse is not as much as that of an RN, but they can do a certain amount. So scope of the RN responsibilities is definitely more complex than that of an LPN. The LPN has to complete a training program. They're usually around a year's time, and they then get to work in different settings. And of course, nurses can become nurse practitioners, and there's a whole field, a whole number of jobs for nurse practitioners. Chapter 12 was on dentists, and dentists usually work a regular week, same number of hours as most people do, right? Which is usually your 35 to 40 hour week. And dentists make good money. They go to school for 8 years, and they do a lot of different things on teeth. And dental hygienists, which is more than a dentist assistant, they clean teeth, they do preventative care, they do x-rays, and they have a pretty big role in the dentist's office to help with all of the preventative care by keeping the mouth healthy so the dentist has less work to do. Okay, and then we had chapter 13, dietetics. And in dietetics, we know that we, right now, to become a registered dietitian, nutritionist, the the person needs bachelor's, and they need to be supervised and have pretty much a post-year intern, which this is also changing, but right now that's the requirements, and of course they're considered experts in their field. Okay, the next chapter is on chapter 14, pharmacists, and pharmacists need a doctoral degree now to become a pharmacist. PharmD is what it's called. That's a 7-year program, 4 years of college, 3 years of a higher level graduate, which gives them a degree as a pharmacist. And then we have and they work with all the medications. They know a lot about all the chemical compounds that are in medications. And then we have pharmacy techs, and they help out with the pill dispensing and the moving of the pills around. Now, even though it's not, they don't have to know about the chemicals in the pills, when the different places hire pharm techs, they really do want them to have some sort of training program that they've gone through. Okay, the next chapter, 15, is on optometry, and there's different facets of dealing with the eyes. So at the lowest rung is called an optician. An optician actually grinds the lenses, and since there's so many people aging and so many people end up needing eyeglasses, this is a very high demand field, and it requires a 2-year degree. They learn to grind lenses and dispense, and they usually own a shop. Okay, they do usually own a shop. Now, optometrists are doctors that deal with the eye and certain eye problems, but only related to the eye. They're not medical doctors, so only issues related to the eye. So they can talk to their patients about how their eyes should be optimally cared for, and they can do the exam, and they can even do some minor surgery, but they don't do anything the way a doctor would do it. Okay, they have to apply to an optometry school and get in. This is after 4 years of college. They have 4 years more of optometry school. And once they do that, they would finish the 4 years of optometry school, and at least before that, again, as with doctors, 3 years or a 4-year degree before they get into the optometry program. And finally, speech and language pathologists in chapter 16, communication impairment professionals. A speech and language pathologist, in order to practice, needs a master's degree. And they work with a lot of different areas, from the elderly to the young. They're able to evaluate swallowing, do an evaluation, evaluate children's speech patterns for those who are developmentally delayed. So that is the midterm exam review, and I hope that it was helpful. Thank you.